You all are probably aware that it was exactly 1 year ago today that Louisiana confirmed its first case of COVID-19 through a positive test result. Since then, there have been more than 430,000 cases in Louisiana, and more than 6.1 million tests have been administered. And you can remember how hard it was to get the testing program up and running. We just didn't have the test available to us. But a year later, we've tested, again, more than 6.1 million people. And of course, we're getting close to 10,000 people in Louisiana have died from COVID-19. This has obviously been a year of grave loss and heartbreak, but we have come a long way since that first case a year ago. Most importantly, at least for me, is that we now have 3 safe and effective vaccines that are going to help us and the rest of the country, indeed the rest of the world, put an end to the pandemic. And for that, we can be very thankful. Indeed, there's light at the end of the tunnel. The number of Louisianans who've completed their vaccine series now exceeds the number of Louisianans who've been diagnosed with COVID-19. That's another good milestone that we're looking forward to having many more of those types of milestones, but that's something that I wanted to highlight for you all today. And today we're announcing an even greater expansion of vaccine eligibility. Probably the worst kept secret in the history of secrets. Actually, it wasn't a secret at all. And when you have as many providers as we have in the program who are eligible and approved by the CDC to receive and administer the vaccine, anytime you're making changes, you have to be communicating that up and down the line. And so we started communicating yesterday because we want these new priority individuals to be able to get vaccine just as quickly as possible. Effective immediately, all Louisianans 16 and older with certain health conditions that make them more likely to suffer a serious complication from COVID-19. So those who are more vulnerable to the disease will be eligible to receive the vaccine. The conditions listed by the CDC that place an individual at a higher risk, and there are a number of them, and they're more than the parishes that I just listed. But I am going to go through them one time, and of course this is all available online. And I'll give you that link in just a moment as well. But these comorbid health conditions that make people more vulnerable to the disease are asthma, cancer, cerebrovascular disease, chronic kidney disease, chronic liver disease, COPD or chronic obstructive pulmonary disease, cystic fibrosis, Down syndrome, heart conditions such as heart failure, coronary artery disease, and cardiomyopathies. Hypertension, immunocompromised state, that's a weakened immune system from solid organ transplant, immunocompromised state from blood or bone marrow transplant, immune deficiencies, HIV, use of corticosteroids, or use of other immune weakening medicines. Other conditions include obesity, severe obesity, overweight, pregnancy, pulmonary fibrosis, severe neurologic conditions such as dementia, sickle cell disease, smoking, type 1 diabetes, type 2 diabetes, and a blood disorder, thalassemia. Say it again. What he said. Please note that as of right now, only the Pfizer vaccine is authorized for individuals 16 and 17 years old. And so if you're 16 or 17 and you qualify because of one or more of these conditions, that's the only vaccine that you're going to be able to take. The Moderna and the Johnson & Johnson are approved at 18 and older. For a list of these conditions and a list of locations where you can schedule an appointment to get the vaccine, as well as the contact information that you need in order to schedule that appointment, please visit covidvaccine.la.gov. You will need to complete a form for your vaccine provider that will be available at the location that certifies that you have one or more of these health conditions. Obviously, it is extremely important that people be honest, and that only the people who have these conditions or in this age range actually avail themselves of the vaccine. Otherwise, they will be depriving someone who is at greater risk to having a severe complication or severe case of COVID-19 from having access to the vaccine as soon as it would be available to them otherwise. So asking people to be honest, obviously, as we have been throughout. We came to this decision after hearing from our providers over the weekend that there's a little slack in the appointments and that they were able to accommodate and ready to accommodate more people. We also have had a very stable supply, especially of the Moderna and the Pfizer. So we feel comfortable about what's coming ahead. And then Operation Warp Speed has told us, and I'll be speaking with them again in just a short while, that those amounts are going to be steady going forward. And then eventually, probably towards the very end of the month, we will get an additional allocation of Johnson & Johnson as well. That should be steady from that point on out. So the availability of the vaccine is such that it's the right thing to do and the time to do it. I do want to remind people that appointments are always required for a COVID vaccine. But it's not just that the supply of vaccine has become stable and actually increased over time. It's also the fact that when you look at our gating criteria baseline numbers, whether it's percent positivity, cases, hospitalizations, and unfortunately deaths, they've all become stable. So we're no longer getting better, not getting worse, with the possible exception of Region 5, and we announced that to you all when we made the change to the current restrictions and mitigation measures in the proclamation. So we've stopped improving, and in every previous instance when that has happened, there was another surge. We don't want there to be another surge, and we certainly don't want any increased cases to be among those people who are more vulnerable. So that's one of the reasons that we're doing this right now as well. And then the last part of this is we know that here in Louisiana and across the country, a larger percentage of cases are being driven by the variant strains of the coronavirus, particularly the one from UK, the B117. And we know that it is more easily transmitted, and that by itself means it's more deadly because there's a certain percentage of people who get COVID that are going to die. And the more people get it, the more going to die. But it's, in addition to being more transmissible, it is also more virulent. And so we are literally in a race against transmission of the virus, especially the new variants. And so that's one of the reasons that we wanted to expand these eligibility for the vaccine at this time. So it is good news that we're able to do it, and we didn't want to wait. We would normally wait and do this after the weekly press conference as it is regularly scheduled, but our goal is to not have any vaccine sitting on a shelf any longer than is absolutely necessary. And so this new priority that I'm talking about is effective immediately. That's another reason we had to communicate with all these providers yesterday. With the increasing presence of the more contagious, more virulent strains of the virus, it also underscores what we told you all from the very beginning. Our primary goal in establishing priorities for vaccination would be to preserve hospital capacity and to save lives. And that is why we are working with individuals with the comorbid health conditions that predispose them to a poorer outcome should they contract the virus. This is fully consistent with what we've been telling you all along. And there are certain groups that are listed in the approach that we're going to be taking eventually that really go by industry group or occupation and so forth. And I do expect that we will get to those at some point. In the meantime, there will be people all across Louisiana in every industry grouping, every type of occupation who are going to be eligible for the vaccine. And so it'll be eligible for those who most need it, regardless of where they work or whether they work. So if you have one of these underlying conditions and you are 16 and older, you are eligible, period. That's where we are today. And everyone who is in the prior eligibility groups remain eligible. So teachers, healthcare folks, and all of that. Remember, I told you, it's not like a light switch where we're going to flip certain people on and then off. Once you're on, you continue to be on for the duration of the program. We're also expanding eligibility for any staff working in congregant facilities such as prisons or jail staff, shelter staff, group home staff, because of the especially high level of exposure they have. And you don't want individuals bringing the virus into a congregant setting if you can do anything to prevent that from happening.